So, welcome to the Renfert Expert webinar series. Today I would like to welcome Alić from Croatia. He will open the series of lectures. My name is Manfred Tauber and I'm head of global education at Renfert. Together with our international lecturers and experts, we at Renfert would like to offer interesting topics such as morphology, anatomy, also the function, aesthetic and red and white aesthetic, to the fabrication of through-to-nature restorations. Our lecturers are experts from everyday work, with a lot of knowledge and know-how. We can look forward for this. But now to our speaker. Alen Alić is a dental technician from Croatia, Karlovac, since 2004. Where he also completed his education. In addition, he completed a 2-year Advanced Master Ceramist program at the University of California, Los Angeles. At the UCLA 2014 until 2016. Alen is an international speaker. In 2016, he received the International IPS EMAC Smile Award from Ivoclar Vivaland. Now I look forward to an exciting presentation and hand over to you, Alen.
Hi everybody. First of all, thank you, Manfred, for introducing me, and thank you, Renfert, for invite me to be a part of your webinars. As Manfred says, I'm Alen Alić, and I'm dental technician coming from Croatia, from Zagreb. And today the topic of my lecture is gonna be a morphology, the shape of the tooth, and diagnostic wax-up. I'm gonna present the way how I'm doing it, and you can see that there is a different how other technicians different, and as I say, I'm going to show my way. So first of all, I want to show you what I'm doing with wax, and as I said, it's my passion. I like to using wax up for mimicking or the natural tooth. And with wax, you can really train yourself, and you have different dentin colors or incisal colors. You have gingiva colors. So this is one slide that I want to show you what I like to do. And actually, this slide, it's my portrait. It's not so nice, but it's me, it's my auto portrait, self portrait. And here you can see that I like to do the Geller model, and I like to copying the nature and present with wax. It's cheaper and easier way how you can do such a hyper realistic copings of your upper jaw example. So, but first of all, to do something like this, you need to practice a lot. And as I said, the waxing up is like a drawing or painting or writing. It's a learnable skill. So, example, if you know how to write, you will easily know how to do the wax up, but you just need to learn how to do it. And example, it's the same with the sculpturing. You know, you just need to practice and practice a lot, and you will know after a long period of doing the same thing, you will know how to do it. It's in our profession, it's very important to copy something. Example, it's much more easier to see something and then transfer that as a copying. And it's like a painter or modeler. it's how they are doing. And I learned that in one great course. It's a drawing course. When I was studying at UCLA, the first week of our program, we have the drawing course. And it was really amazing for me because in 5 days, we learn how to draw. And this is the kit that we have. It's like a drawing kit where you, in 5 days, you actually learn from the beginning to the end how to draw some different drawings. And I'm going to explain you a little bit. So there is 5 basic skills of drawing, and it's not these skills of drawing. It's not drawing skills. It's perceptional skills. How you perceive the object, the person, or the landscape. And let me go through very fast through 5 of them. It's the perception of edges, the perception of spaces, black spaces, and the perception of relationships. And there is a light of shadow, which is very important when you're doing, example, the texture of the tooth. And all these skills that it's drawing skills you can easily transfer to waxing up or building up ceramic or whatever in our profession. So let me show you. This is the picture that we do on Monday. It's on my left side. The picture that we do on Monday, and on Friday we repeat the same picture, and you can see how based on these skills how you can improve your drawing skills. So basically, even if you add just the shadows and on the painting, you will see like the big difference. It's like 3D picture. And so the right picture we did on Friday, and actually you can see the big difference between first and second picture. And why I mentioned this drawing course? I mentioned it because it helps me a lot to transfer that knowledge, to my profession, to waxing up. And when you learn these skills, it's much more easier for you to do the wax up more closely to the nature. Okay, so basically this is what, after that course, what we did. It's we copying the natural tooth, and it's all in wax. First we copying that with one color wax, with gray wax, but then after we start to copying the same tooth but with color, just to add not just the shape of the tooth, we add also the color of the tooth inside. And here you can see the edges of the tooth, the space, how the shadow, the lights, how we place this tooth in the position is the same position like the tooth that we copy. And later you will see what is the next exercise. It's the exercise not with the wax, it's the exercise of carving. When you're carving the same stone from the block, you're carving the natural tooth. It is a little bit more difficult exercise. Why? Because it is there is no room for mistakes. If you remove some part, you cannot add, like wax. So it's a little bit different type of practicing, but more difficult, of course. So here on this slide you can see how from the different angle, this carving tooth. You can see that on this middle picture, it's not exactly the same, but it is almost the same, and our goal is to be as closest as you can mimic the natural tooth. So in every in dimension, in volume, in everything, you need to copy exactly the same tooth. So I learned that from this book. It's Mr. Shigeru Kataoka and Yoshimi Nishimura book. I like this book, and I want to also present you this book because it means a lot to me. Why? Because it is very important. I'm going to show you just a few slides from this book, and it is very important for me as a morphology book. So you can see here the labial, the vestibular surface of the tooth, and a lot of grooves, and a lot of ridges, a lot of different things. And also from palatinal side, you can see the tooth from palatinal side, and proximal side, and from incisal part, you can see how tooth is twisted. But in this webinar, I don't want to be focused on the shape of the tooth. I'm going to be focused more of who was my mentors and who opened my eyes for how I learn the stuff that I know now today. And this is the book and my mentors. This is the book that really helped me a lot. The second book that helped me a lot is from Jan Haito, The Anteriors. The Anteriors book, and you can see here, together with this book, you have a lot of samples of a lot of different anteriors, male and female, and you can always, when I do my diagnostic wax-up, I like to copy something. I don't like to I really like to copy something, and this is the best way, because you have different types of different shapes, different you have oval, you have the triangle, you have all kind of different shapes of the tooth. So every time when I'm doing diagnostic wax-up, I take my wax-up model and I take this model, and I like to copy some of them. First, I ask my patient if he likes some shape that I know in which direction do I need to go, and then I copying that. It's not only that you have the models, you also have the pictures of color, of the tooth color, and it's easier also to copying the color of the tooth. Why this book it's very important for me is because you can show the patient how nice teeth can look, but how they can look very nice but not symmetrical. They are asymmetrical. They are in different position, a different angle of the tooth, the shape is different, and then you can closely you can present patient how future diagnostic wax-up can look for them. Okay, so this is my protocol that I always do with my cases, and you can see that first I go with a picture, with the intraoral pictures, portrait pictures, and then I always based on these portrait pictures, I always prepare my models, and I do the wax up. And then after wax up, I'm doing the mock-up. So this is the pictures that I insist from my dentist. And the most important picture, it's the picture of the cheek retracted, that I can see the lines. Okay, this is the picture that it's very important for me. And why is this very important? Because based on these pictures, as I said, I always prepare my study models. I grind the base of the model parallel with bipupillar line, just that I have the right angulation of the model, and then you will see I try to mimic the correct midline, and then this is my models ready for waxing up. And then when I have this picture, I place my model on the, how do you call this? It's like a table for articulating, and you can see the angulation of the model goes a little bit like this, but the back side of the model, it's always parallel with bipupillar line. So when I place it, it's the same position. I trim my model as is the same position as in the articulator. I try. It's not perfectly the same. It's not exactly the same, but it's really very close and helps me to not mess with my eyes when I'm doing the wax up. Okay, then I have the articulated model, and after that I start to choosing what kind of shape should I do with this patient. So I try always, you can see here in this slide that there is like 1,000 of different incisal shapes. So almost every patient have different shape of the tooth. So first I try to find which shape is the best for my patient. And you know, the most of the time, the best shape, it's already existed shape that patient already have in their mouth. So I always try to mimic that shape, but a little bit better, a little bit nicer, or a little bit bigger, or something like that. So basically, when I start doing the wax up or diagnostic wax up, I have these two kits of Renfert, and the first one is it's the aesthetic wax that you can mimic the exact color of the tooth, and it comes with different dentines color and the different translucence of the dentin, and it helps me a lot with playing, with practicing, and also to teach, example, kids in the school how to do the natural tooth. And also you have this gray wax that usually I'm using it for diagnostic wax, because I just want to be focused on the shape. I'm not when I'm doing diagnostic wax up, I'm just focusing on the shape, not on the color. And the other wax set, it's functional wax set, where you can see different colors, blue, green, yellow, red. And this wax, it's more for functional wax up. And also I'm using it for to teach the kids in the school how to do the functional wax. And it's very nice to understand how are tooth, how our function is made, which casts, I think it's for what, and it's very interesting, but today topic it's not the functional wax-up, it's more like the diagnostic wax-up. Okay, so this is the slide where I can show you. I always send to my dentist the pre-op model. It's the situation that it's existed, and the wax-up, the diagnostic wax-up, where I can show what we can do with our future work. So example, in this case, we gain the function again, and not just the function, there is also the aesthetic part, where when you put the mock-up in the mouth, patient will see how she looks like. Okay, so this is the final result of the diagnostic wax-up, where you can see I always try to here it's very good with the gray wax-up. It's very good because the contrast between white model and the gray wax, it's like really big, so you can easily see the lines, the gingival lines, is it correct, the incisal lines, are they correct, or the midline. So that's why I like this gray wax, because of the contrast. And also here you can see always before and after wax-up, where this is what I'm sending to my dentist. It's always before and after, and with some silicone keys that he can transfer this wax-up to the mouth as a mock-up. Why diagnostic wax-up? It's very important for us. It's not only important for me as a dental technician to see the function and to see the prototype, how it can look in the mouth. It's also very important for the patient that he can see the final result in their mouth. So it's easier to present the patient the final work if he can see that in the mouth. And it's also very important for the dentist, because if he needs to prep, he will prep over the mock-up, and it's very important not to grind too much tooth, to save as much as we can of the tooth structure. So that's why the diagnostic wax-up, it's very important in everyday business. Okay, so here you can see in this case I use not gray wax, I use the white wax from the set of the aesthetic wax set. I use the white wax just to not to have this contrast between white stone and the wax-up. I want to present that to the patient, and you can easily see the difference between the pre-op phase and the final phase. And here in this case we close the diastema. The picture in the middle, it's sometimes I grind the model just to show my dentist what is necessary for me to do this work, how much space do I need to have for these mini veneers. And on this picture, it's the same patient, just the different angle. Sometimes I like to send to my dentist these pictures just that he can see what I'm thinking of, in which way our case should go. Okay, so this is my last case that I did a few weeks ago, and it is just the diagnostic wax-up. I'm gonna show you very fast how I'm doing it. It's the pre-op model, and you can see when you place the lines that the midline goes a little bit, it's like a little bit curved, and you will see the difference between the laterals, the difference in the gingiva, and the canines are almost the same size. It's okay, it's not so difficult case. And now I'm gonna start to do the wax up. First, sometimes if we are sure that our patient will accept the treatment, then I can grind a little bit of the tooth if I need more space. If we are not, if we don't know if the patient will accept the treatment, then I don't touch the tooth. I just wax up on the already existed position of the tooth. Sometimes it's a little bit bulky, but sometimes it's okay. But if we are sure that we're gonna do this case, then we can grind some stone a little bit. Example, if the incisal part goes a little bit out, we can grind that. And here in this case, you can see that I always grind a little bit approximally because I want to create my own approximal sides. Okay, so this is where I put, first I put the wax on the gingiva part, on cervical part, and I close the gaps between the tooth. I close the approximal parts of the tooth. Then I try to go a little bit with the shape of the tooth, so I make it a little bit longer, wide a little bit, and you can see that I always do that incisals, not always, but sometimes that incisals are a little bit longer than the laterals, but the incisal line of the frontal teeth, it's always the same. The incisals and the canines are almost in the same position. Then I place a little bit of ridges, and then I add distal ridges also, but everything very rough. You can see that it's very raw. It's not clean. So I just adding the wax. I don't do anything with my knife. I don't carve anything. I was just adding the wax. And here you can see still everything rough. I add a little bit of volume. And when I think that I'm close with the shape and with everything, then I start to carve a little bit. And where I spend the most of the time, so I just go very fast with a knife, but with no pressure. I just do the texture, but still you can see that my approximal parts are not touched. Everything is raw, and now I try to make the lines between the tooth, just very sharp, very raw, very not so clean. And then I try to clean all these approximal parts with a really sharp scalpel. And I spent most of the time on these parts, on approximal parts where two tooths are connected, on the contact points, on the contact points, and on these approximal parts. I spend, let's say, 60% of my time I spent on that. I just focus on that. Okay. And then here you can see the final results. I just clean the surface a little bit. I leave the texture that I already added in with a wax knife. So I just clean, I smooth everything, and now you can see that I correct the midline, and you can see the gingiva line. It's almost symmetrical. you can see now when I add this incisor line, you can see that they are almost symmetrical, but I try not to do always exactly like the mirror symmetrical. I always like to do a little bit twisted, a little bit one over each, and you will see later. So this is the final result. You can see a small texture, and just a second. You can see like the small texture, but very important, it's be focused to that every tooth looks like separate from each other. Okay, so don't try to do it like in one block. So try to make them 3D. That there is a lot of surface, like how to explain that. It's very difficult to explain like through webinar. It's much more easier when I show with my hands and on the model what actually I'm doing. So on this next slide, you will see, okay, here you can see how they are a little bit twisted, how they are not symmetrical. Try to do them, try to do the centrals as much as you can symmetrical, but the laterals, they are never symmetrical because of the position of the gingiva, the position of the root. Everything is different, so it's very difficult to manage to do the laterals symmetrical. And the canine, they are not so difficult, you know. For me, it's very important just with the canine that you have a function with the canine guidings, and that's it. And sometimes also when I'm sending to my dentist the wax up, if I have time or if the case it's very difficult, then I grind my model. I prep tooth just to show my dentist how would I do it if I'm gonna place the ceramic where I need more space, where I don't need space, where they need to grind more because of changing colors or something like that. And if I'm doing with my dentist who is on the other city or long distance cases, then I always take a picture and then I send to my dentist. So basically, this is then this is some other case where I did this is pre-op situation, and then this is the mock-up situation. So with this mock-up, it transfer from the wax up, so you can see exactly what is going to be the final result of this patient, and also the patient can see the difference before and after. And actually, this is what I always do. So the wax up, it's mandatory in my protocol, and I always do the wax up. So that's it. I think we are done, and it was not so easy for me. It's my second time that I'm doing the webinar, so yeah, I think that's it. Thank you for watching. Thank you, Manfred, for be patient and give me a time for my webinar. So thank you.
What can I say? It was very interesting, Alen, and we saw a little bit of your way, how you improved your knowledge, your everything what you are doing, and also a little part of your workflow to be successful to reproduce through to nature restorations. I think this is a way, and everything is with skills, with knowledge, what we need. Thank you very much for your excellent lecture, for your presentation. We are very happy, and I wish you all the best for your future. Okay?
Thank you. Thank you.
Bye-bye.